Welcome everybody to a presentation of my analysis of the BRFSS 2016 data regarding the impact of sugar-sweetened beverages on the residents of New York City. So why are we focused on sugar-sweetened beverages here? Well, for the sake of our analysis today, we'll be looking at drinks that are soda and fruit drinks that classify as high in sugar. And these drinks are a significant contributor to unnecessary added sugars in U.S. resident diet. SSB consumption has also been associated with several negative chronic health conditions, including obesity, cardiovascular disease, and diabetes. Federal data has also shown that 26.3% of surveyed individuals consume at least one sugar-sweetened beverage per day. We're also focused on New York specifically because state-specific information is limited regarding this topic, whereas there is more data in the federal scope. So some of our methods. Data analysis was performed using the Behavioral Risk Factor Surveillance System from 2016. The survey collects uniform state-specific data regarding health risk behaviors, chronic diseases and conditions, access to health care, and the use of preventative services to leading causes of death and disability. Phone interviews are conducted, and self-reported data is collected from individuals in all 50 states of the U.S. and U.S. territories. Data related to the 2016 obesity outcomes of New York residents are being examined specifically, and participant characteristics included in the analysis were compared using the individual's current weight status, categorically broken down into normal BMI, overweight, and obese individuals. Characteristics examined included sugar-sweetened beverages drank per week, individual sex, age, whether they identify as Hispanic, their race, level of education, income, and amount of physical activity in the last 30 days. We also looked at any history of cardiovascular disease diagnoses or diabetes diagnoses. And we broke down sugar-sweetened beverages drank per week categorically with 4 levels, either none, 0 to 1, 1 to 7, or more than 7. To begin, the dataset was uploaded to StataBE 2018, where it was cleaned and eventually analyzed. The process began by creating a subsample of the data of New York residents so that we can examine our population of interest. Variable distributions were individually examined for the presence of outliers or errors. Several variables such as sugar-sweetened beverages drank and diagnoses of cardiovascular disease were condensed for the sake of the analysis. And then linear regression models were run to check for necessary assumptions. Once we had adjusted some variables, linear regressions were run to check the crude association between sugar-sweetened beverage consumption and body mass index. The adjusted regression was then run to determine association between SSB consumption and BMI, along with potential confounding variables. Complex survey weighting was applied to both crude and adjusted regressions. So what did we find? Well, our primary research question again is to attempt to find any associations between SSBs drank per week and an individual's body mass index. Associations were found from groups of individuals who drank more than 7 sugar-sweetened beverages per week. 2% of the group were at a normal BMI, while 19% were found to be overweight and 21% obese, which is higher than any other category of sugar-sweetened beverages drank per week. Some other interesting findings included race, education, income, and physical activity within the last 30 days. BMIs were fairly similar among white individuals, while there were higher rates of overweight and obese black participants. Those with lower levels of education also had higher rates of overweight and obese individuals at 37% and 43% respectively. Participants who had completed college were found to have higher rates of normal BMI, lower rates of overweight individuals, and obese participants. Similar to education, income, Those who made less than 25,000 had more participants in the obese category, and again, this is annual income, while participants who made greater than 50,000 had fewer obese individuals compared to those at a normal BMI. Lastly, whether or not the participant had partaken in any form of physical activity over the last 30 days had associations with body mass index. Those who answered yes consisted of more individuals with a normal BMI, while rates of overweight and obese individuals were lower than those who had not performed any kind of physical activity over the last 30 days. So in conclusion, based on our analysis, there are some associations between the number of SSB strength and an individual's body mass index. Those who drank 7 or more sugar-sweetened beverages per week were significantly less likely to have a normal BMI. As such, public health initiatives should focus on outreach and education regarding the effects of SSBs on the body. Regulations and sugar content of these drinks would also help to improve the health of United States citizens. Future research should continue to collect data on how the frequency of sugar-sweetened beverages drank impacts an individual's BMI. So our proposed intervention. After looking at some previous research, there is promise regarding education of the negative health impacts of sugar-sweetened beverage consumption. Proposed intervention would work with schools to build programs in order to provide this education to students and also make sugar-sweetened beverages ideally less accessible, within the school itself. So the initial research would be conducted by providing the program to middle and high schools in several low-income areas of New York, and then we'd use one school as the control, where the program will not be implemented. Education will be included in the students' typical schedule, so no after school, and ideally that will allow more students to participate. And the program will include an environmental component as well, characterized by controlling access to beverages. We look at our social ecological model here, and I apologize if my webcam is overlaid, but we're going to try to provide some interventions at the individual level, meeting students, and then institutional within the school itself. So a little bit more about the intervention. The program main goal is to reduce the amount of sugar-sweetened beverages consumed and increase the amount of water, ideally, that the student drinks. Education will be focused on the negative health impacts of sugar-sweetened beverage consumption and provide options for some healthier substitutes. Students will be initially surveyed for variables of interest and their attitude toward sugar-sweet beverage consumption. Following the program, students will be surveyed for initial behavioral change, and researchers will conduct monthly surveys for 6 months post-intervention. Students will complete the program, and data from schools where the program was implemented will be compared to the control. Rates of sugar-sweetened beverage consumed, water consumed, and the individual's behavior towards sugar-sweet beverage consumption will be compared in order to determine whether or not the program has had a positive impact. If it has, then hopefully it will be implemented in more areas of the city. Finally, here are my references. I appreciate you listening, and I look forward to hearing some of your presentations.